my name is Mary Campbell, and I'm a nursing instructor here at East Tennessee State University. And today, in this video, I'm going to be demonstrating and then explaining how to introduce yourself to a patient and perform a general survey. So here we go.
Come in.
Hello, how are you
Hello.
feeling today?
I'm feeling all right.
All right. My name is Mary, and I'm going to be your nurse today. I'm here to do some vital signs on you and perform a head-to-toe assessment. Would that be all right?
Sure.
Okay.
Sure.
Can I check your armband?
Okay.
All right. Let me see your armband here. Okay. Can you tell me your name and your date of birth?
George Stano, 3451.
Okay. Excellent. And what would you like me to call you today?
George is fine.
George is all right? Okay, great. All right. Well, I'm going to get started. Let me get my supplies.
Okay.
Okay. So when we're preparing to introduce ourselves to a client, we always want to knock before we enter the room and wash our hands.
Come in.
And I wash my hands. Now we're going to introduce ourselves and tell the patient why we're there. My name is Mary, and I'm your nurse today. I'm here to take some vital signs and do a head-to-toe assessment. Would that be all right?
Sure.
It's important that we also look at the patient to see if they're in distress, so that if our goal is to take vital signs and do a head-to-toe assessment, that they're comfortable enough and willing to do so. We want to make sure that our patient is our main focus. Okay, so in my general survey, I see my client and he looks relaxed. He looks happy, pleasant, and he verbally is able to understand me and respond. Okay? Then the next thing I'm going to do is check his armband. We always want to make sure we have the right patient, even if we've been in the room several times. So may I check your armband?
Sure.
All right, let me see your armband. When we check to identify a patient, we do that with two identifiers. One would be name and the second would be date of birth. So can you give me your name and date of birth?
George Stano, date of birth 3451.
Okay, excellent. All right, and now that I've identified my client, it's best to ask the client what they would like to be called. So how would you like to be addressed today?
George is fine.
Okay, great. So now I know that I can address my client as George and we can create a relationship. So while I'm doing this, I'm observing mood, behavior, verbal response, motor response, and the general surroundings in the room. Is my patient hooked up to anything? Does he have any IVs, oxygen, tubes, lines? And these are the things that I'm going to be observing in my general survey so that if my patient is in distress, I can notice that right away. All right, so I will be back to get my supplies and we'll begin our assessment.
Okay.
All right, thank you.